Here, and want to take some time today to discuss the three muscles that might actually be contributing to your arthritic pain. What I mean by that opening sentence is that a lot of people, and I'll be using the anatomy model to show you here, a lot of people are complaining of what they feel like is arthritic pain or osteoarthritic pain or joint pain. And after I've done my assessment, I realized that that's not actually what's causing their pain. They don't have bad arthritis. The joint actually feels good. Their pain is actually coming from one of these three different muscles of the hip. And I want to just show you, and then I want to show you one stretch you can do to start to address that. So the psoas, as you can see in this top left corner over here, the psoas is one of the most commonly found muscles to actually recreate the pain in your hip. You can see that this muscle attaches to the lower spine and attaches to the lesser trochanter here of the hip. When that muscle gets tight, it will have a force on that hip joint where it'll actually pull it forwards. Okay, you'll actually find that because of the hip flexor, particularly the psoas, is so tight, it'll kind of put the femur in a poor position, which can cause some extra wear and tear on this front lip of the femur. All right. However, there are a lot of times too that the muscle itself is just so tight that if I palpate that muscle, a lot of times it'll be kind of even in here. If I palpate that tissue, and you go, oh my gosh, that's my arthritic pain. That's what my doctor says arthritis. I'll be like, no, it's not. I just touched it. I really can't touch, the inner part of the head of the femur. All right, I can touch out here, or sometimes people develop like bursitis, but I can't touch in here. So I can't recreate your same pain by palpating your joint. But if I recreate your same pain by palpating the psoas, that's a different story, right? So that's the first muscle that I wanted to cover. The second muscle is actually the rectus femoris. So it is a hip flexor and it's a quad. It actually has what's called a reflected head that actually attaches to the labrum in there. You can't quite see it in this model. But my goodness, is this a common area for people to think that they have arthritis in the front of the hip? It's so common for people to kind of palpate in the front of the hip there. And the reality is it's coming from a really tight rectus femoris. And I've palpated and seen a lot of stringy, tight hip flexors, including this rectus femoris that is causing people's so-called arthritic pain. But it's actually coming from the rectus femoris. The third one is actually the gluteus minimus. So that's the one on the outside. A lot of times people say that they've been diagnosed with bursitis, trochanteric bursitis there. Well, a lot of times they say they have bursitis in the outer side of the hip, or excuse me, they have arthritis on the outer side of the hip. This is a little muscle and it's buried way deep down onto the iliac crest. So if I go superficial, look how deep down that is. You can't even see it here. All right, so I've got to take away the IT band, take away the gluteus medius, and then I get all the way down to this little guy. And let me tell you too, this muscle is so profound, it'll actually be mistaken for radiculopathy down the spine, down from the spine. But a lot of times it can be palpated just from the gluteus medius. So this is a very profound muscle that a lot of times serves as a false sense that it's actually causing your arthritis pain. So I want to kind of just show you one thing that you guys could do. This is really for the first two muscles. I don't have a video loaded today for the third one, but for the first two muscles, and something if you guys just want to try at home, I want to just show you this quick thing that you can do to start the process of help loosening up the hip and maybe even changing your quote-unquote arthritic pain. So you do need a stretch wrap. If you come to our clinic, we'll be free to we'll be happy to give you one of those if you need one. You're going to wrap it around your shoulder and get into this half kneeling position. And you can see how I'm using my hands, I'm pulling down. It's wrapping around my ankle. and I'm getting one heck of a stretch to the front of my thigh. With the knee bent like this, we're probably targeting more the rectus femoris, but since the hip's going into extension, I certainly believe that we're getting some level of the psoas too, okay? I will say this may not be a bad angle to try to target your gluteus minimus. And there's a couple different things you can do here. You can kind of kick the hip out to the left and kind of lean so you get that stretch down the outside. But you notice I actually brought my heel in midline compared to that position right there. Right there, my bias a little bit more of the rectus femoris. And you'll see in a second as I let the heel come in, that might get a little bit more of the medius. Especially, I don't show it here, but if I kick my hip out to the left, I might get a little bit more gluteus medius or minimus. So those are the three muscles, guys, that can be pseudomonic or that can kind of mimic your arthritic pain in the hip. So the iliopsoas, the rectus femoris, or the gluteus minimus. Try that stretch out. If you have any questions on this, guys, just feel free to let me know. Thank you. Take care.